Hi, I'm Caitlin.
And I'm Clarinda.
And this is Not Just Patients,
a podcast where we break barriers to meaningful patient involvement in healthcare.
Thank you so much for tuning into this very special year-end episode of Not Just Patients. We wanted to do something at the end of the year to reflect back on what 2025 has been like in the world of patient engagement. So in order to do that, instead of having one live guest like we usually do, we're mixing things up and we've asked 5 different guests from different countries, different roles, different backgrounds, what their reflections are for 2025 and what they're looking forward to in 2026.
So go ahead and have a listen to our special guests, Richelle Flanagan, Connie Montgomery, Dr. Ratna Devi, Richelle Flanagan, and Keith Berelowitz, as they share what gave them hope in 2025 and what they're looking forward to in 2026.
Hi everyone, it's really great to be here today, and a huge thank you to yourselves, Clarinda and Caitlin, for inviting me. I'm Michelle Warner, co-founder of the Patient Project, which my business partner Sean Feller and I set up at the end of 2024. We'd both been working for many decades in the pharmaceutical industry, mostly in global medical affairs, where we were working on new medicines predominantly. And the focus then was all about scientific and clinical data. Sadly, rarely was the most important question being posed, which is, of course, how will this actually really change patients' lives for the better? And it made us realize that while we were doing incredible science, we weren't always connecting it to the people who needed it most. I'd also experienced life as a patient with breast cancer, all good in terms of the outcomes, but, the journey itself wasn't great. And living in the shoes of people really experiencing challenging healthcare journeys shone a light on everything for me. And then we were both coming to terms with our parents who'd been diagnosed with Alzheimer's, and they were becoming more and more dependent on us as carers. So the time was right for us to set out with a clear mission to make sure that medicines deliver real value, not just to patients and to caregivers, but also to the healthcare professionals providing them and the teams developing them. And we've been doing this by partnering because, as we all know, collaboration is where true impact does happen. If there's one lesson that's really stayed with us in our first year, it's this: the incredible power of patients connecting with each other. It's amazing how much depth and honesty comes out when patients talk to each other without the, filters of the pharma regulations, or in fact, that structure of a healthcare-led conversation. And we've been creating these podcasts. So the patients are setting the agenda, they're shaping the topics that they need or they believe need to be heard. And here's the thing: these are people living with the same condition, yet they've never met before. They might come from different countries, different socioeconomic backgrounds, and every single conversation has taught us something new. And if we think about it, peer-to-peer engagement is everywhere now. We all trust the reviews before we buy something. We learn new skills from people online. We follow innovators sharing all of their ideas. So why wouldn't that same dynamic transform healthcare? And there's one moment that I'll never forget when I was listening to Lauren and Sahara, 2 young women living with Crohn's disease, sharing their hopes and fears. And Sahara described leaving the house as if she was packing a baby bag. And as a mum, albeit a long time ago, I remember those days vividly, all the essentials and all those sort of just in case items. And the image she portrayed really hit me hard. It's not just about managing a condition. It's about that constant weight of planning and the invisible burden that was shaping all of her daily life, really. So we're calling this initiative Living Proof. You'll soon be able to hear these raw, unfiltered conversations on the listening room page of our website. They're honest, they're human, and they remind us every day why patient engagement really does matter. This year, we've had the privilege of attending loads of conferences and meetings as well, and we've met some incredible patients and advocates, especially those that are advocating for rare diseases. But here's something that really struck us both. Rare just doesn't always mean uncommon. Sometimes it just means it's a disease, might be very common, but it's misunderstood. And one example of this actually is chronic cough, something we've been working on. It's widespread, yet patients often struggle for years and years without the right diagnosis, the right treatment, or the right care. It's a reality that we absolutely can't ignore. So as we look ahead to next year, our hope's clear that the voices of patients who are rarely heard, whether that's because their condition is overlooked or because it's misunderstood, are finally brought to the forefront. It's their insights that should be shaping the research, that should be influencing how those findings are communicated, and should be guiding education both for patients themselves and those that are caring for them. Because when patients speak, they don't just share these stories, they share solutions. And if we truly listen, we can change not just treatment development, but the lives of the people that are living with these conditions. And then finally, I've got a question that I thought I might leave you with, and that is, what would healthcare look like if those unheard patient voices became at least part of everyday conversation?
Hello, my name is Connie Montgomery. I'm a person living with Factor VII deficiency, which is a rare bleeding disorder, and Pemphigus vulgaris, an autoimmune disorder, and 3 chronic illnesses: hypertension, diabetes, and CKD, which is chronic kidney disease, stage 4. I am very active and involved in the patient engagement space, and I feel like it is the place I am called to serve at this time. I enjoy working with nonprofit organizations, healthcare systems, and even pharmacare, just to impact how they see and interact with patients. That's important to me. One thing that I've learned in patient engagement for 2025, or a theme that I find as a hot topic, is definitely not just having us there for a checkbox or to meet a quota or for tokenism, but to actually care about what we're sharing with you, and then to see the impact from what we've shared with you in your policies, your procedures, and how you carry out services after we interact with you. That's very important, because it's not enough to have our voices at the table. You must be willing to work with us from the beginning of the processes, throughout the processes, to the end of the processes, to develop and create the services you, your healthcare system, your nonprofit organization, or your pharmacare company wishes to see go forth. We have to be a continual part of the process, as well as we have to be compensated for our time and our expertise shared. We are a valuable part of the process, and our insights as well. And I really believe all patient engagement activity should be treated as such. That has been one very incredibly hot topic in 2025. What I'd like to see going forward is patient engagement officers, chief patient officers in every healthcare system and nonprofit organization around the globe. I think it's so important to have a key person in those spaces who can coordinate the services and keep a strategic record of who's involved, how they're involved, what has been done since their involvement, and have some metric of measurement in place so that we can see the value of patient engagement in all of these sectors and spaces. What I'm looking forward to in 2026 is more companies, pharmaceutical organizations, healthcare systems, and nonprofit organizations coming together in partnership to work with people who have lived experiences, which are patients, caregivers, and all of those that are in service. Because we as individuals are whole people, and we need whole system care. And that is going to take working together. Thank you so much for this opportunity to speak with you all, and I look forward to sharing in the future.
Hi everyone, this is Dr. Ratna. I'm a public health physician, but more importantly, I'm a patient advocate with a lived experience in a chronic autoimmune condition. I'm the co-founder and CEO of DakshamA Health, which is a patient advocacy organization working in India. And we have been working for more than 1.5 decades around patient engagement and patient empowerment. If I had to pick one big learning from 2025, it's this. Patient engagement only works when we stop treating it as a consultation and start treating it as a shared leadership. This year really showed me that when patients are brought in early, not as an afterthought but as co-designers, everything changes. The conversations, the solutions, and even the sense of trust in the system. I've seen this across the rare disease work that I do in the country, the cancer reimbursement reforms that I'm trying to bring into my workspace, the digital health pilots. No matter the context, the pattern is the same. When patients help define the problem, we finally solve the right problem. And that's the shift 2025 made very clear to me. We are moving from patients being informed to patients being partners, and that transition is not just the right thing to do, it's the most practical thing to do. The one moment that really gave me hope this year came from a story shared by a caregiver during a rare disease roundtable. She talked about her son's diagnostic journey, years of uncertainty, countless referrals, and then said something that was remarkable. She said, "For the first time, I wasn't explaining the system to the doctors. They were explaining it to me." That single sentence captured a shift I've been sensing all year. And this happened because her country had rolled out a more coordinated referral pathway for rare diseases. The clinicians had been trained in early recognition and counseling, and the family was connected to a patient advocacy group right from the first visit, not after years of searching and scrolling. It wasn't a big national policy change. It wasn't a massive budget announcement, but it was a structural fix that made a human difference, not only to one family, but to thousands of families that were seeking early referral and early diagnostics. And that story gave me hope, because it showed me that when systems listen to patients and when patient groups are treated as partners, small changes add up to meaningful change. And I've been seeing this pattern throughout 2025. At the Rare Impact Hackathon that we recently organized, where young developers co-created tools with patients, not for them. In the state health missions, finally inviting patient leaders into technical working groups. In hospitals, piloting patient-reported outcomes as part of value-based care. In caregivers, becoming confident advocates because someone finally equipped them with the right information at the right time. The hope also came from seeing advocacy turn into influence and influence turn into action. For me, 2025 proved that patient engagement is no longer a nice to have. It's becoming a source of innovation, accountability, and compassion in the system. If there's one thing I'd love to see next year, it's this. Patient engagement becoming embedded in the system, not being invited into it. Right now, so much of patient involvement still depends on the goodwill of individuals. A clinician who believes in co-design, a policy maker who thinks that the right space needs to be created for patients and patient groups, or a not-for-profit or a patient advocacy organization that keeps pushing no matter what. In the coming year, I'd love to see structural, predictable, built-in participation. That means patients having a seat at the decision-making table by design and not by exception. Not because somebody wanted to tick the box, but because somebody felt that without patients, the solutions are meaningless. Thank you so much.
Hello, my name is Richelle Flanagan. I'm a registered dietitian with 20 years experience. I've lived with young-onset Parkinson's disease for the last 9 years, which I was diagnosed with shortly after the birth of my second child. I'm based in Dublin, Ireland, and I've been an advocate for the last 7 years because the first 2 years I hid my diagnosis for fear of stigma of having a brain disease. It was only when I attended the World Parkinson's Congress, which is the biggest congress in the world that brings people with Parkinson's, their loved ones, clinicians and researchers together, all in the purpose of finding better ways to live with the disease, find ways to slow progression, and find a pill to its cure. And it was only when I was there that I really saw the power of advocacy to make a difference. So that started my journey in advocacy for Parkinson's disease. And I have co-founded My Moves Matter and the Women's Parkinson's Project. So a key learning around patient engagement for me this year was actually seeing that the last 7 years of work advocating around the importance of including more women in research and the importance of looking at the differences between sex and gender in research and the impact of hormones on neurological symptoms in Parkinson's actually came to bear finally this year in seeing a huge increase in the number of papers being written in this topic, and also seeing grassroots level researchers really including this differentiation in their research, whether it's in animal studies or in human studies. And I was at the Parkinson's UK Grant Showcase Day where researchers presented their work, and it was really powerful to see there was one presentation in particular that looked at their data and realized that there was a sort of a signal in terms of between men and women. And basically they didn't meet their outcomes, but when they looked at the study by separating the men versus women, the outcomes were met in women, but not in men. And that was a real example of advocacy coming down the line in terms of, researchers really listening to us and looking at the detail. As they say, the devil's in the detail. And also, which was really heartening, is a lot of the people who presented their proposals had actually considered sex and gender in their research. So it just showed to me that, it's taken a long time, but it's worked and people are starting to really take it seriously. So that was really a big thing for me in 2025, is that not to give up, to keep raising your voice and to engage, researchers, clinicians, everybody in the movement. What gave me hope and engagement this year is also an organisation called the Movers and Shakers, which was set up by 6 people with Parkinson's who are so well-known personalities who came together in a pub in Notting Hill to do a podcast. And they came up with the idea of a Parky Charter. And this year they had a petition. They needed 100,000 people with Parkinson's and loved ones and supporters to sign the petition to get the government in the UK to discuss Parkinson's care needs. And they got it. They got 100,000 people. And it really showed the power of movement in terms of when patients, come together. And what would I love to see in 2026? I'd love to see more focus on the message of enablement rather than disabling messages. So I think often people with Parkinson's are met with, this is progressive neurodegenerative disorder. Here's your pills and off you go, sort your life out for the next 10 years. I think there's so much more that people can do in terms of enabling them to live a better life with Parkinson's, a longer life with Parkinson's. So I'd really like to see that become more of a focus in 2026. So thanks very much for having me on and wishing you all a happy Christmas.
Thank you for inviting me onto Not Just Patients. I appreciate this space because it reminds us that everyone involved in clinical research, patients, families, clinicians, researchers, and biopharma is trying to make sense of something complex while doing their best to move things forward with integrity and care. My name's Keith Berelowitz and I'm the founder and CEO of pRxEngage. I've spent more than 20 years working in clinical research, but my connection to this work started much earlier. When I was 11, I lost my best friend Sylvester to sickle cell disease. It was the first time I saw how powerless families can feel when they don't have clarity or options. Later in life, I had my own moment of uncertainty during a cancer scare, and despite decades of working inside research, I struggled to understand my clinical trial options. And years before that, we learned that my wife and eldest daughter live with a factor 11 deficiency. It's manageable now because we understand it, but it didn't start that way. Those moments taught me something simple. Uncertainty steals agency, understanding restores it. And that idea, restoring agency, is the heart of what we do at pRxEngage. We help people understand clinical research in a way that feels genuinely human and clear. We take complex study information and translate it into plain language. We support both medical suitability and emotional readiness. We provide multilingual study pages, structured eligibility steps, and tools that help people connect directly with research sites, all at their own pace and on their terms. A big part of our mission is supporting rare disease communities, not exclusively, but intentionally. The needs are often greatest there, but our commitment is to all conditions, common or rare. Everyone deserves clarity, dignity, and support. And none of this work really happens alone. We collaborate closely with community groups, charities, clinicians, researchers, and biopharma, teams who all share one goal: a better experience for all and better outcomes for all people. I was asked to talk about what 2025 taught me. Well, it taught me that meaningful patient involvement is no longer optional. It's becoming a shared expectation and a shared opportunity. This year I've seen patients, advocates, researchers, and biopharma teams co-design more openly, communicate more transparently, and recognize that lived experience and scientific expertise strengthen one another. The future isn't patients replacing industry voices or industry overshadowing patients. The future is co-design, co-ownership, and shared responsibility, and that shift gives me real optimism. What gave me hope in this year was all the people I met, families and advocates, those who navigate uncertainty with courage and clarity. One relationship that changed me on a personal level was meeting Jamie during his journey to find a clinical trial for his son, wee Jamie, who lives with Duchenne muscular dystrophy. What started out as me simply trying to help another parent navigate clinical trial information turned into something much bigger. We talked, we planned, we problem solved, not as a patient and industry, but as two people trying to open the door to possibility. That connection became a friendship, and it became a collaboration neither of us expected. Today, wee Jamie is now enrolled in a clinical trial. He's on the next phase of his journey, and being able to walk alongside them, even in a small way, has been a privilege. Their honesty, their resilience, and the fierce love that drives everything they do reminded me what true partnership looks like. It reminded me just how powerful families and clinicians and researchers can be when they work together, rather than in isolation. And I've seen this again and again. Families stepping into their agency, communities lifting one another up, and organizations stepping forward with genuine collaboration instead of defensiveness. The sense of togetherness is growing, it's a shared momentum, and that's really what's been giving me hope. As to what I want to see next year, well, next year I'd like to see patient involvement to move from consultation to true co-ownership. I want behavioral science, motivation, emotion, cognitive load, trust, all of this built into studies from very early on, if not day zero. I'd like to see communities shaping protocols before they even resemble protocols, from endpoints to burden to communication. And I want a field that communicates openly, acts bravely, and acts with humility. Let's do better. People don't need perfection. They need honesty, they need clarity, and they need humanity. And they deserve to be partners, not passengers. And no more of the blame game, everyone. So really, in closing, to everyone listening, patients, families, clinicians, advocates, researchers, and biopharma partners, I thank you. We all want the same thing: clearer understanding, better access, and better outcomes. My commitment is to keep working alongside you, openly and collaboratively, and to help make research kinder, clearer, and more empowering for everyone. Thank you to Not Just Patients for giving me this platform to speak. And thank you to the communities, including Jamie and wee Jamie, who've trusted me with their stories. We're moving forward, and hopefully we're all moving forward together. Season's greetings to you all, and I hope for a great 2026 for everyone.
So wasn't that great, Caitlin? I really enjoyed listening to all our guests. I think some things that stood out for me was that 2025 seemed to have achieved a lot of momentum in patient engagement. I was really happy to hear from all our guests about how they've seen the power of patient advocacy. It might be slow and it might be a long process. It might take years to materialize, but eventually the rewards are really tangible. So it's really great to see that patient advocacy has borne fruit for many of our guests this year.
Yeah, I agree. It's really inspiring because I know that, we've spoken before about how sometimes you can work on something, but things don't just change overnight. And it shows that actually, if you keep using your voice and working towards something, there are ways to kind of break through and enforce change. And we got some really nice examples of that today. I think the other key theme that came across was about multi-stakeholder collaboration and really involving patients in a meaningful way. So that's been happening more in 2025. I think initially maybe people were starting to have patients in the room, but using them really as a tick box, not really considering them right at the beginning from the start as a collaborator, but more as someone to sort of validate because it looked good on page or because they had to have a patient in the room at some point. But it sounds like they're more really getting a seat at the table, being meaningfully involved, being listened to, being compensated. And I think all of those things just really show that actually the value of patients is being recognised. And I know that there's still probably a little bit of a way to go in that respect, because a few people mentioned it in terms of what they want to see for next year. But I think it's really encouraging that it is moving in that direction, and hopefully it will only snowball.
Absolutely. I can't wait for that to happen. So I think we heard from all of our guests about what they're looking forward to in 2026, but I'd love to hear what you are looking forward to, Caitlin.
Yeah, I mean, I totally agreed with all of what our guests said. They were all really fantastic things that I'd love to see. But just thinking about what sort of really topical outside the healthcare space, because I think we do need to make sure that the healthcare environment is up to speed with what's happening. But there have been so many advancements this year in terms of technology, in terms of AI and how that's being used to really make processes more efficient, make things more understandable, make things easier, and also just generally how far tech is coming along and being really integrated into everyone's life. I mean, there's an app for absolutely anything you could possibly want at the moment, right?
Yeah.
And some really cool sort of med tech devices that are also coming through to help make patients' lives easier. So I think what I'd love to see is if that can also be brought into processes so that actually patient engagement or engaging with advocates is easier. I know that we've spoken to a lot of people this year about the barriers to patient engagement, and there's sort of processes, there's sort of archaic policies, there's just practical barriers. And I think if we can embrace the new technology, the platforms, everything that are available, we could actually streamline those processes, ensure people are involved, ensure that patient engagement is something that's accessible. And I think that would really help more people to get involved.
Yeah.
So I'm throwing it back to you now, Clarinda. What would you hope for 2026 in terms of patient engagement?
So I think that to balance all this technology, I would like for more of the human touch to remain. And I think one of our more popular episodes this year was the one on shared decision making. And interestingly, that was also one of our more popular ones last year. So I think I would like to see more clinicians embracing shared decision making at point of care, for more patients to feel like they have a place in that room in every medical consultation, and just to feel like they have a right to ask the right questions, and for more clinicians to feel like they want to partner with patients and to bring that warmth and that partnership, as it were, into clinician patient interactions. So that would be lovely to balance the technology.
Yeah, absolutely. And just to be clear, I wasn't suggesting that the AI robots should take over and replace human interaction either. Because I guess just to that point as well, it's a reminder that we talk about patients all the time on this podcast, but we're not just patients as well. We're people, and we're people who can really have feelings and lives that impact our health, but also people with experience and knowledge that contribute to discussions in a meaningful way.
So happy holidays, everyone. Have a wonderful end of 2025, and we can't wait to see you back in 2026 with our first episode for the next year.
Thanks so much for listening. This has been our special year-end episode of Not Just Patients with our guests Richelle Warner, Connie Montgomery, Dr. Ratna Devi, Richelle Flanagan and Keith Berelowitz, and your hosts Caitlin Rich and Clarinda Suresh.